Further discussion. Representative Valderrama.
Bill.
To the bill.
Colleagues, today I rise in support of HB 2010A. Bringing a child into the world should be a time of hope and excitement, not stress and uncertainty about affording medical care. Thanks to Medicaid, thousands of expecting parents in Oregon receive the critical prenatal services they need to have a healthy pregnancy and a strong start for their babies. Medicaid covers nearly half of all births in our state, 57% of children, and approximately 42% of Oregon Health Plan members are people of color. That means that thousands of parents, regardless of their income, have access to vital services like regular checkups, ultrasounds, screenings for complications, nutritional counseling, and maternity services at many of our community hospitals. Reauthorizing these resources is a commitment to protecting access to care for children, seniors, low-income families, and rural communities. These services help families by helping babies be born healthier and reducing the risk of low birth weight, premature birth, and long-term health issues. Without Medicaid, many families, especially those in rural or low-income communities, would struggle to access care during their pregnancy or even at all. Delayed or inadequate prenatal care increases the chances of serious complications for both parent and child, leading to higher rates of emergency C-sections, extended hospital stays, and long-term medical challenges. Oregon's preterm birth rate is 9, the highest that Oregon has seen in the past 10 years, with American Indian and Alaska Native Oregonians preterm birth rate 1.3 times higher. Significant disparities are still seen among babies born to Black women and birthing people. These outcomes not only affect families, but also increase healthcare costs for everyone. But this bill is about our families, our community members, and the new family members they bring into this world safely. Oregon is proud of how Medicaid funds care for maternity care. Our state invests in nurse home visiting programs where healthcare professionals check in on pregnant mothers and provide guidance on everything from nutrition to mental health. Medicaid also supports maternity care coordination, connecting mothers with the necessary resource like transportation to appointments, addiction treatment, or mental health support. And in 2014, Oregon began to cover doula services for birthing people in Medicaid too. We know that access to pre- and perinatal services, and doulas in particular, are one way to address inequitable maternal health outcomes and positively impact the well-being of new parents and their babies. Access to these services has improved Oregon's birth outcomes, including lower infant mortality rates and better maternity health. Oregon's infant mortality rate has steadily decreased over the past decade. Women who received doula care via Medicaid in 3 U.S. states had lower odds of postpartum depression and anxiety. So colleagues, by investing in this maternity care, Medicaid is not just saving lives, it is reducing long-term healthcare costs by preventing complications before they happen. By ensuring access to quality prenatal care, we are investing in the next generation of Oregonians, giving them the healthiest start possible. Colleagues, I urge an aye vote.
Thank you, Representative. Further discussion.